Okay, thanks again, everyone. And if you have not already done so, if you need to join the audio portion of this conference, please dial 866-740-1260. Access code is 715-3863. And just a reminder regarding the technology, as you guys can tell, the lines have all been muted. This is due to the high volume of participants. So if you have a question, if you can't hear the speaker, if you need to speak with either myself, I'm designated as the chairperson, or a co-presenter, Stefan Adelson, then please go ahead and use the chat box that is to your left. So we want to welcome you. We're really excited to be presenting this webinar. This is a third in a series on IPS services. And it really fits in nicely with a lot of the work that NCSD already does, particularly around MSM and sexual health. That's a key priority for us, given the high rates of HIV that we see and the climbing of syphilis among MSM. We're also concerned with the lack of screening in non-genital sites for chlamydia and gonorrhea, so that is high on our priority list. And of course, drug-resistant gonorrhea is something that we are closely watching. In addition to our MSM sexual health work, we also have a large health equity portfolio, of which, of course, our MSM population is included in that, as they are disproportionately affected by STDs, including HIV. So this fits in nicely in terms of our IPS work. And to talk a little bit more about our health equity work and our new project, the funded by the MAC-AIDS Fund and done jointly with our colleagues at the National Alliance of State and Territorial AIDS Directors, otherwise known as NASTAD, I'd like to introduce our Health Equity Fellow, Justin Hill. Justin, please go ahead.
Hi everyone. I hope you can hear me clearly. Today I'm just going to bring you up to date with some of the work that the NASTAD and NCSD are doing together. So with funding from the MAC-AIDS Foundation, we partnered together to create a national survey which is tailored to assess stigma in healthcare settings. So that's the health department, looking at health department staff, healthcare providers, and community stakeholders. The goal of the stigma survey is to examine stigma on multiple levels to see how how healthcare services are impacted by stigma, particularly with MSM, but particularly looking at Black and Latino men. In addition, we are also doing our optimal care checklist. And the optimal care checklist is us pulling together a panel of experts to facilitate the creation of this checklist. It's going to be a two-part checklist. One part of the checklist is geared toward medical providers, and it will assist public or private providers who lack knowledge of gay, bisexual, and MSM's health issues. It's going to provide a cheat sheet of tests and exams that are necessary to standardize care practices for men who sleep with men. The optimal care checklist also will have this. The second part of it will be directed at men who sleep with men, and it's just much more conversational and trying to help them look at their holistic health, like prostate cancer, dealing with other ST screenings that are not just genital based but are site specific. So like having oral screenings and anal screenings just to check for syphilis, gonorrhea, and chlamydia. So I want to thank you guys for taking the time to let me speak and introduce myself. I'm, as Andra said, the Health Equity Fellow here, and now I'm going to pass you over to Stefan Adelson.
Good afternoon, everyone. Thank you for joining us. We're going to move on and talk about cultural competency, men who have sex with men, and internet-based partner services. Our main goal today is really to take an in-depth look at sex-seeking behavior and what is found in online communities, specifically communities that serve gay men and other men who have sex with men. It's important in our work that we aren't completely surprised by what we find in the online culture when we conduct internet-based partner notification in particular. So it's hoped that this webinar will help prepare supervisors and disease intervention specialists to interact with the population online, because there will be a foundation of understanding. Not everything is exactly as it appears on the internet, I think, as everyone knows. So hopefully this presentation will help provide some guidance with policies, practices, and just increase the perspective and broad range of possibilities that happen online. So I want to give everyone fair warning. I have made every attempt to block out any X-rated images, but you will be exposed to adult language during this webinar. It's unavoidable. It's unavoidable on the internet, and there's no way to blur or replace the words and get the meaning, and the words are part of the online culture. I've done every effort as well to remove any personal information, such as screen names. But if you are exposed to any of that, I hope that we will respect the confidentiality of members. So just so we have an understanding and a foundation of the conversation, we're talking about culture, which is really the set of attitudes, values, goals, and practices that make up a group. And this group happens to be men who have sex with men meeting online within a community. A community will evolve over time, and we'll talk about that, and culture develops as the community evolves. So when we talk about being competent within a specific culture, there's some certain requirements that help to increase the competency level. And one of the components is awareness of your own viewpoint. The other is your awareness of your attitude towards differences. And then knowledge, which is what we're trying to increase today, is really increase the knowledge of the cultural practices within online communities. And then one of the competencies is also cross-cultural skills. So once you have the knowledge, you understand your viewpoint, you can actually take a look at your skills and develop the skills from there. When we talk about virtual communities or online communities, the terminology is still not solid. The terms virtual community and online communities are often interchangeable. So a virtual community is really any community that interacts together, usually with a mutual interest online. An online community is much the same. Dating sites are different from social networking sites because a dating site will not have a public display of friends. A social networking site is termed as a social networking site because it mimics networking. And networking is going from one person to another. So I introduce you to my friend introduces you to their friends, and that's what happens online. If you think of Facebook, which is the largest social networking site, that's exactly what takes place. You have your Facebook profile, and on your profile you have a public display of friends. When someone comes to your profile, they see this public display, and they can actually meet your friends through you. So you're networking from person to person. A dating site does not have this public display of friends. So it is not in all actuality a social networking site. It is a dating site. All of the connections like buddies and friends are private. They're not publicly displayed. Dating sites that are targeted to a specific market, such as gay men or a certain behavior, are generally termed niche sites or niche dating. Hookup sites are sites that are focused on sex seeking. When we started to interact with hookup sites, they were originally termed chat rooms. But this is a misnomer. A chat room is actually a public room for public discussion and is very, very different from an online community or a hookup site or a social networking site. And it's important to note because when you develop policies and procedures and guidelines for internet-based partner services, referring to an online community as a chat room can bring in extra concerns regarding privacy because chat rooms are very public, where that's not necessarily the case with the communication channels that are built into the online communities. So it's an important distinction to make that these hookup sites and dating sites and niche sites are not chat rooms. A mashup is when two or more different types of sites are taken and combined, and we'll talk more about those later. It's a big trend right now to do things like mix pornography with social networking or webcam sites with dating, and we'll see some examples of that later on in the presentation. When you take a look at the metrics that are used to evaluate a site, one of the terms that you hear often is unique visitor, and the other term is visits. So if I go to visit a website, the first time I go, I am a unique visitor. If I return, I become a visit. It's just a visit. So I'm a unique visitor once, but I visited twice. So when you look at the activity of a site, you'll see metrics that say, 5 million unique visitors in 30 days with 27 million visits. So that would mean basically that there were 5 visits per visitor in that 30-day period. Taking an in-depth look at members, this is a generality, but it'll help give us an idea of the type of users that we'll come in contact with online. Starting with the most active users, the core users. Core users tend to be a smaller percentage of the population, but a very important percentage of the population. They're on the site quite often. They have an investment in the community. They contribute a great deal to the cultural norms of the community because of their level of participation and interaction. They establish deep friendships. They generally have frequent sex partners and are very active users. So that's a core user. A regular is someone who logs in a few times a week, maybe more. They may be partnered with another person that is or is not a member. They're committed to participate, and they have connected friendships, and they have occasional sex partners, not quite as much as the core user. So they're users that come quite frequently but are not as active as core users. The term inbound is someone who's on their way to becoming a regular or a core user. They're a newer member, they're active, they're in their process of establishing community. They probably have a good amount of sex, possibly more than a regular, because they still have excitement around the site. They're still new. They're making their way around. They're getting to know people. And then there's lurkers. In a lot of social situations, like in Twitter, for example, lurkers are the majority of the population. But in sex-seeking sites, the core users really amount to most of the traffic. But most users are core users, regulars are inbound. There's not a lot of lurkers. The lurkers are there, but they're not as large percentage-wise as they would be in like a Twitter. So a lurker is someone who logs in once in a while. They'll have occasional sex, not many friends, and may have someone that they go to see regularly on the site. A core user or a regular can turn into a lurker over a period of time. And that can happen as a result of many different reasons and events, and we'll talk more about that later. There's also a life cycle of a membership, and we'll go into a little bit in the life cycle of a membership. And part of that life cycle is a departing member. So a member starts, they're a lurker, and they work their way through, and they may become a core user. A good number of members will be members for a period of time and then have some type of event that motivates them to leave the site. It's often a very impulsive action. So I've been a member of the site a year or two, and I'm just leaving. I'm kind of done with it. I'm over it. And it's usually a result of some specific event or a buildup of some emotions. They may get into a relationship. There may be some built-up shame or guilt or some difficulty with self-acceptance or acceptance of a lifestyle or behavior. They may have some event that happened with another member, and there may be some behavioral boundary that they actually crossed as a result of things which we'll talk later, like being pushed to some limits by some interactions. Or it may just be someone who wants to get a fresh start because, as I mentioned, when you first join a site, you're new to the site, there's more interaction. People want to get to know you, especially if you're a good marketer. So people might say, well, nobody's contacting me anymore, so I'm going to delete this profile and I'm going to create a new profile and start all over again. In most cases, people who do have this interest in the community but then do depart, they tend to come back again. And I've given you a sample here of a profile from a website where someone has come back. Throughout the presentation, what you're going to see are profiles, and if you would, please read the profiles as I go along. I'm not going to read them to you because you do have them in front of you. But they will give you real-life experiences that will back up the words that I use to describe. So there's several terms that disease intervention specialists, especially those that are doing the partner notification, need to know. They're listed here. I'm not going to go through each one of those. This presentation will be available for download shortly after we're concluded. But you will see these terms throughout profiles on all the sites, all the hookup sites. So they're not just specific to one site. You'll see things like bareback more often on sites like Bareback Artie, where the site is actually focused on unprotected anal intercourse. So you'll see terms that are more geared towards the behavior that the community adopts. You may not see bareback as often on a site like Manhunt or Adam for Adam. And that's important to note. So when you do join sites, you can take a look at the terms that are used, and you can glean some of the cultural norms just by reading the terms that are used. So the focus of all of these sites is really about marketing. What people are doing is they're creating a profile to market themselves as a sexual object. So that's why they're overtly sexual. It's not that the individuals that join these sites live their whole life around sex. There are individuals that do, but they're not the majority. So it's really important to remember that people that join these websites are full people. They're not just sexual beings. They have parents, they have jobs, they're probably on Facebook with a very social circle. They're probably on Match.com or a dating site where they take long walks on the beach. So it's very important to remember that what you're seeing is someone that's focused on marketing a very particular behavior. It's not the whole story. The tools that are used for marketing are images. Some people will post images of their face and make those public. Some people will post images of their genitalia and make those public, and keep their face private. It's just a different way of being. Text will usually be as graphic as possible. One advantage that websites have is it cuts out the conversation. Hookups previously in bars and other locations, you go to a bar and you might meet 5 or 6 people in an evening. You have a conversation, and maybe you go home with one person. But you can browse through 5 profiles in a couple of minutes online, and that's one of the biggest differences. What makes hooking up online effective is when someone is very clear in their profile about their intention and their behaviors, so that like-mindeds can reach. People with the same intentions can find each other quickly. Another marketing tool is physical characteristics. One of those physical characteristics is penis size or positioning. We'll talk more about HIV status, but HIV status may be considered a physical characteristic, which begins to bring up the question of HIV stigma and how the sites influence HIV stigma. There's also special talents. So if someone is particularly good at oral sex or it has a particular talent, they'll generally advertise those in their profiles. Aside from all of those, sometimes availability may be the predominant marketing tool. I'm available now. And some of the other preferences, such as image and text, may not have the same weight because someone is just available now and someone is looking now for whatever reason. So as I mentioned, there is physical characteristics as a marketing tool. HIV status is a physical state, being either positive or negative. And there are some benefits to having HIV status displayed in profiles. One of those is that it allows zero sorting. The case where serial sorting absolutely works is when an HIV positive person is sorted with another HIV positive person. Any other possible combination is not 100% positive. There's no conclusion as to the outcome of that meeting. So when someone states in their profile that they're either HIV positive or HIV negative, what does it mean to other members when you're marketing yourself for sex? I think that there is the potential for an increase in HIV stigma. I did a blog post on this back in January. It's so far the largest commented on post so far, with 172 comments from members. And I would encourage those that are interested in cultural competency to check out the blog, blog.adamforadam.com, and then click on health, and you'll find several topics. There's been posts on disease intervention specialists, outreach in the virtual world, and I generate these topics not to push an agenda, but to get feedback. It's my own qualitative study, if you will. And here you see some comments from members that talk about they're not going to advertise such personal information, or I think the safest thing to do is assume everyone's positive. So there's a variety of comments that I think are very important for us to hear. Items like this can also help us determine the culture of the website. So it's not always just about sex. It's also often about intimacy. And here are some examples of profiles that talk about people who are here or on different websites to get to know people. There are a lot of motivations for people to connect. And sex is often a motivating factor, but there are behaviors behind sex, and we'll talk a little bit about those later as well. And these behaviors may not be on the conscious level, but on a subconscious level. And they probably have something to do with connection. So these are people that are looking for a more intimate connection, and you'll find these frequently on the site. One of the features of the internet right now is that there aren't a lot of good dating websites for men to meet men. And the sites that have been created for dating have tended to been taken over by adult images. Because in gay relationships, a lot of the times they start with sex. The introduction is really, are we a sexual match? If we are a sexual match, then often the relationship will continue and grow from there, which is a little different than in most heterosexual relationships. I'm speaking in a lot of generalities today, and please know that there are always exceptions, and there is some stereotyping being done and some traits that are being pulled out. So this is not everyone within the population, but it is, in my experience and in my observations, the majority. Okay? There's also a fantasy element to the websites that may or may not be true. So it's possible that people will advertise behaviors that they actually may not be willing to engage in if they're kind of called on their quote-unquote bluff. So the two profiles beneath are young men who are looking for more of role play with a daddy. This is off a website that is an intergenerational website. So this may or may not be a situation where they're looking for someone to help financially support them, or they're just looking to role play, or they're just working out some kind of fantasy. So you can't take a profile as the absolute literal truth. So I want to make sure that everyone's clear that what's happening on the internet with hooking up and sex, it's not just gay men. And we're focused on gay men and men who have sex with men because of the infection rates that affect the population and what happens to sexual health with gay men at a disproportionate rate. So that's why we're focused on this population right now. There's some examples of some sites here on this slide. Ashley Madison is one of the largest sites on the internet. They rank number 421 out of the millions and millions and millions of websites on the internet, with about 4 million unique visitors over a 30-day period. And Ashley Madison is a site for people to step outside of their primary relationship. You'll notice that their slogan is the world's leading married dating service for discreet encounters. So it's been intended for people who are married to step out of their primary relationship. They get quite a bit of activity. And you'll see a list of the niche dating sites there off to the right, everything from religious personals to baby boomer personals. And there's many, many more. There's bigger and beautiful personals. And so what has happened is the larger sites have actually been broken down into niche sites. When we talk about the culture of men who have sex with men, there was a study that was done in 2007, 2008 by Simon Rosser that took a look at gay communities, and the conclusions were is that there's this that gay communities are under this form of structural decline, and that many kind of blame the internet for this, that people aren't meeting in physical locations anymore because of the internet. And what this does is it makes things much more complex, especially for us that are involved in public health. The complexity begins with just the access conversation. So, how do you begin to engage with cultures and populations that are online when you can't get there? And if you can get there, what capacity do you have to go to the same places? So what happens is there tends to be this rift between what is happening in the real world and what we're able to understand in our work-a-day world, because we don't have access to the world that a lot of the population does. So the two sites that I've just chosen here to give examples of that is Adam for Adam, which has 2.5 million active profiles with over 26 million million visits over a 30-day period. And they have about 120,000 men online nightly. When you see these numbers, these online numbers, it's not a constant. So 120,000 people don't log on and stay online. There's thousands and sometimes tens of thousands logging in and out every minute. Facebook, and we'll talk more about Facebook later, but it's larger than North America with about half the population logging on daily. There have been quite a few studies that have taken a look at risk online, and I just relatively indiscriminately pulled 3 and got some of their key points. As you read these, you'll see that they're not necessarily congruous. They haven't come to the same conclusions. They've come to different conclusions that tell a story, but not necessarily the story. And I think that some of these studies may actually be a bit of a red herring, because what happens beyond the internet is the actual encounters. I don't know that we would need to study the telephone, for example, to the same depth, or that we would need to study highways where cars are carrying people back and forth. So this is a little bit of my opinion, but I think that where we need to stay focused is in how we affect the face-to-face behavior, not necessarily how individuals meet. And is there potential to use the internet to affect some of that behavior? I believe there is. So if we're not taking a look at the internet and risk on the internet, what is it that online communities really do? I think the thing that they do the best is they increase the supply. The example I gave in a bar was that you may meet 5 people in an evening and go home with 1. Where on the internet you can meet 5 people in 5 minutes and basically leave your door unlocked and have a stream of individuals to your home every 30 minutes. If you're a good scheduler, it's quite possible. So it increases the potential for the supply of sexual partners. Advanced filtering options help you to find exactly what it is that you're looking for. Another concern for us in sexual health is what happens to the networks, the sexual networks. The one thing that the internet does almost as well as increase the supply is it brings together once closed networks, and we'll talk about this more in depth later. It increases the number of partners, and I think that there is a real fact of increasing impulsive behaviors due to exposure and the availability. And what I mean by this is I see a behavior that is new to me, and I can engage in this behavior in the privacy of my own home without anyone knowing, just with the click of a button getting that person to my home so that I can try this thing that I just saw and do it with all, like within 10 minutes or 20 minutes. And it may not be something that I would engage in if I had the time to actually think about what I was doing over a period of time. It potentially increases exposure to drugs. And I think that it also has an effect on internalized homophobia. I know that in my work with adult websites, I've spent a lot of time looking at images and going through page after page of profiles. And there have been times over the last 11, 12 years where I've looked at the population and wondered where exactly I fit in. Seeing these images of people who are marketing for sex over and over again on a day-by-day basis, I at least started to wonder exactly where I fit into this picture because it didn't necessarily portray my day-to-day existence. And I started to battle my own prejudice and internalized homophobia. It turned out to be a good thing, just so you know the end of the story, but it did bring into question where I fit into this world. And I think that happens for especially regulars and core users who are exposed to this as their culture more than any other offline culture that has to do with men who have sex with men. And I do think that there are changes in social norms. For example, if you join a website, and in that website, the majority of members are focused on unprotected anal intercourse. If I don't engage in unprotected anal intercourse when I join the site, I'm going to be excluded from the site, and I won't be a part of. And we as social creatures have an innate need to be a part of. So I actually may change my behavior so that I can fit into the social norms of the community. And some of those norms, as I mentioned earlier, may just be fantasy. But the line between fantasy and reality, the virtual world and the real world, is not always well defined. Okay? So taking a closer look at increasing supply and filtering options, I'm not going to go into this in depth, but you see off to the right kind of a standard search form. This is off the website Adam for Adam, and you see that all the criteria that's in a profile become searchable. So if you're looking for someone in Massachusetts that's 18 to 22, that's interested in having one-on-one sex, that wants to find someone with a mixed race who's an oral focused person with a swimmer's body that's smooth, that likes to do drag, does drugs often, drinks often, and is not out, smokes socially. Okay, you get the point. So you can get very, very particular with who it is you're looking for. Okay. So breaks down once closed sexual networks, and here's a couple examples. Xtube is the top right example as you face the screen. They've got almost 9 million members. The numbers on Xtube are not true numbers. You don't have to become a member to view the site. Basically what the site is a combination of pornography and social networking. So people and companies upload clips of porn. It can be self-generated porn, amateur porn that you make at home that is things you're into, or it may be a short 2 or 3 minute clip from a production studio. It may be a gay clip, it may be a heterosexual clip, it may be a bisexual clip, it may be something else. So these all get uploaded into one big website, and behind that are individuals that upload those. Each one of those persons has a profile. So if you look at a video, you like what you see on the video, it's an amateur, and that amateur is available to you, you can contact that person. The site was really created to promote pornography and use it to highlight clips for porn and get people to purchase the porn. But there is a good percentage of the population that's actually using it for dating. So when I, as an individual who describe my sexual orientation in a very specific way, I go there and I see pornography that's pornography I've heard about all my life and I've never seen it, and there it is right next to what I'm accustomed to and have seen a million times, I may be very inclined to look at something I've heard about but never seen. And then if I see that and I like that and I want to engage in that behavior because it looks like fun, this is where the impulsivity can come in. I can just click on that and get that person to my house very quickly. Underneath that, you see Cam4. Cam4 is a webcam site where thousands of people, at this time I took this screenshot, about 50,000 people, were watching basically 1,600 people that were live on cam. It's free. It's usually exhibitionist, but now they've included money into it. So I, as an audience member, can watch someone on their webcam along with up to, I think it's 150 people. And each one of us can contribute, 10 cents or $1. And it adds up and becomes a sizable amount and asks the performer to engage in specific acts. So, do this, do that. And over the years, as I've watched this site grow, I've watched performers change their behavior. So it's almost as if there's this natural behavioral intervention where a performer gets egged on to do more and more and more things and is motivated by money or by praise from the audience or some kind of combination of both. So I've watched a lot of behavior change, especially when they added the option to tip the performers. It's been a really interesting experience, and of course I'll research. So you see Craigslist here listed as well, and we'll talk a little bit more about Craigslist later. So these are some samples from Craigslist, actually. These are individuals who may be engaging in impulsive behaviors. So you've got an 18-year-old, a 28-year-old, and an older gentleman, each with different motivating factors who are seeking to act out on something they haven't done much. So they're engaging in behaviors that they may not engage in if there wasn't an anonymous way to find partners to engage in this behavior. And it takes less than 2 seconds, well, okay, maybe a minute, to create one of these ads if you're watching your spelling and being thoughtful. And the ads are completely disposable. So you create the ad, you put up what you want. When you get what you want, you delete it, and it's as if you were never there. It's anonymous. No one knows who posted it unless you meet face-to-face. So this is a study that was conducted that just came out from the Journal of Psychoactive Drugs. It took a look at a random sample of a little over 300 men who have sex with men who are seeking to engage in unprotected sex. I don't think that this study is typical for all sites. I don't know what site most of the participants came from, but they found that 60% of the men in the study versus basically 10% of men in the adult population reported use of illegal drugs in the preceding 30 days. And you'll read the other data there next to that. I've created some screenshots of profiles. You'll see the one up top that says, "Where's my party bottoms?" You'll see that there's a capitalized T. What that means, it's kind of code for crystal methamphetamine or TINA or T. So they've capitalized the T. And then you'll see in the other one, always up for partying. So these are typical profiles. Most of the sites will do all they can to change text like this, but it changes. It's like whack-a-mole. One term will become popular, it will get removed. The term that started was P&P, party and play, which was synonymous for crystal meth and sex, but now it's become T. So on the positive side, one thing that sex-seeking communities also do is they provide a connection. And there's a plethora of possibilities when people connect, especially for growth and development and feelings of inclusion in society. So, the tale's not all grim. There's some really wonderful things that happen in online communities. I've seen these sex-positive communities support members who have gone through a very bad time. One instance that comes to mind, I collected some data from Manhunt when Katrina hit. And during that time, we sent out a survey and asked people how they used the site during Katrina. And what we found was that users of the site used it to find people who were lost, to get housing, to get food. So there's a lot of positives to being able to connect people online. And it's a tight community. especially for people who join the community and become regulars or core users, they get to know a lot of people. Part of what happens is, sex starts very strong in the membership, and as time goes on, sex becomes less of a priority and friendships become more the priority. So sites or members who are mature on a site tend to have less sex but be much more connected and have closer friends, often joining just to get, or logging on just to get in touch with friends. So I think what this can also do is increase feelings of belonging and reduce feelings of loneliness, obviously. And as I mentioned, it's a possibility for zero sorting, and hopefully you're reading these profiles as I'm talking. So there's all kinds of motivations for sex, and this was a study that took a look at the non-sexual behaviors that motivate men to have unprotected anal intercourse. And everything from someone who's looking for their knight in shining armor to someone who is really looking for a relationship but can't quite get there, so they just kind of go out over and over again. Someone who is quite aware that they're rebelling against the world, and someone who feels they need sex, that sex is a driving force, and then they have this feeling of guilt afterwards, and then they go out and look for sex again because that wasn't the feeling they were hoping to get from sex. So when you think about someone who has sex once or has sex 100 times in a month, it's not all what it seems to be. But then again, sometimes a cigar is just a cigar and sex is fun. So it may just be what it seems to be. And I think what this points out is how important it is that DIS have the skills to understand an individual. And the only way that they can understand the individual is understand the context of their culture. And I think that online communities are a fantastic way to understand the culture from where someone comes, especially where someone is seeking deep connections, like the connections that you have when you have sex with an individual. So, okay, so why are gay men and men who have sex with men so different? Well, from my personal experience, I can tell you that they aren't. I've been involved with this work for a very long time, and in my personal life, I've been involved with mentoring a lot of men over the last 20 years, men who define themselves as heterosexual, men who define themselves as bisexual, and men who define themselves as homosexual. And I can tell you that as we work together and as I mentor these men as individuals and groups, when we start to disclose behavior and some of the motivations for sex and some of the feelings around relationships, we're the same. So when you lift up the hood of a human being, we're all really basically the same. I think what sets this population apart, gay men and men who have sex with men, apart, is some of the mainstream social expectations that are almost exempt from. So if you take a look at religion, which has formed a lot of our society, especially in a Christian-based culture like ours, religion has, in essence, excluded gay men and men who have sex with men from that social norm. Not all. Again, I'm speaking in generalities, but the majority. So what this does is it sets gay men outside of this morality framework. So gay men and men who have sex with men who are not involved in religious life and don't have a religious way of being are free to create their own morality. I think that the lack of some structural expectations of marriage also contribute. So there's this separate but equal type of, well, not even equal, but there's this separation that takes place. So when this separation takes place, there's this freedom to create your own morality and behave according to that own morality. I think one of the biggest differences is the obvious one, which is there's no women involved. And if you take a look at the stereotypical relationship of men and women, women tend to constantly be trying to control the behavior of their men. I think men do the same thing with women, just in a different way. But the bottom line, I think, in that framework and that context is that women tend to say no more often than men. And men are much more driven by sex, and it's probably genetic and part of what's been built in for procreation, or however you term to view it. So when you do start to take a look at the culture of an online community, you want to take a look at the obvious. You want to look at their frequently asked questions, and you want to take time to go through the website and take a look at all of the available features, read the profiles before you start to interact with anyone. You want to be that lurker for a period of time and get to know the community before you actually dive in and try to become a member of the community. In an online community, people are known by their virtual names and their virtual identifiers, which is the screen name, the email address. So it's important to remember that these are identifiers, and in the virtual world, they're the same as knowing someone's name. There are challenges for DIS when you do have a virtual identifier and you don't have a real name. How do you get the real name without letting the individual know that you don't have the real name? But that's another training. So I think it's important to set the right stage when you're with an OP or you're with a partner so that that person has the freedom to honestly discuss their behavior. This is a study that was done that took a look of sexual meaning among a sample of heterosexually identified men who have sex with men. So, how do they maintain their heterosexual identity when their behavior tends to betray their identity? So here are some examples. This individual, Tony, says, I don't do it every day, so therefore I can't be gay. I'm a heterosexual because I'm not doing it every day. And then this guy, Donnell, says it's something that just happens. We all play games to relieve stress. I didn't need to do that. I needed the money at the time. So there's all kinds of motivating factors or justifications or behaviors or mental behaviors that allow people to retain their identity. Frankly, my opinion is that it's easy to be attracted to a behavior and not an individual. So I'm trying to relay this without being overly graphic, but let's say that I am a heterosexual man in a committed relationship with a woman. I have an anus, and I've heard of I have an anus and a prostate, and I've heard of anal sex, and I'm interested in finding out what it feels like to stimulate my prostate. And I find that it feels good to have my prostate stimulated, and something alive is better than something that's plastic. But I'm not necessarily attracted to men. But men happen to have an aperture, a penis, that feels good. So this is one example, I think, that it could be an instance where someone can actually be a heterosexual male but enjoy the feeling of having their prostate stimulated by a human being and truly be a heterosexual. So I think it's very important to allow people to exist in their reality because it's their reality and we don't know that their reality is false or wrong or deluded. And it's the way to conduct a thorough interview and invite someone to openly discuss their behavior. So this was a study that was taken off of an intergenerational website where close to 29% of the entire website's population reported as being married. The majority of the married group were willing to be anally receptive, and a portion of that group was seeking anal intercourse as their primary desire. It's not uncomfortable, or excuse me, it's not uncommon for this to take place not only in intergenerational websites, but on Craigslist, on Manhunt, and the other websites that are plethora over the internet. These are the different types of websites that we've touched on so far. Message boards we'll go into in just a bit. The largest message board or bulletin board that exists now for personal ads is Craigslist. It's structured very similar to the classified ads that are in newspapers around the United States and other countries. So an individual creates their posting, they put it online, they're given a forwarding email address, so it might be 123456@craigslist.org, and that email will forward to their personal email, so no one knows their email address. The posting goes online. There's no membership required. It's completely anonymous. You don't even have to tell the truth. And then once you're done with the ad, you can delete it, and it feels as if it's never existed. Prior to this presentation, I did this yesterday. I went online in Washington, D.C., and I went into the Men Seeking Men. You'll see it purple there, Men Seeking Men. I clicked on that. I confirmed that I was 18 years old, and I did a search for the keyword married, and I got 412 results over the last 7 days. So there were 412 postings on Craigslist that were looking for someone that was married or was someone that was married that was looking to have sex with another man. Bulletin boards are not to be used for partner services because they're public. It's like putting a notification in a chat room. But they can be used for surveillance. I won't go into that now because that's also another presentation. And websites have feelings. So when you do conduct notification, the ideal situation is to conduct the notification where the introduction took place. And most of the time, that's going to be a sex-seeking website. It won't be all of the time, but it will be most of the time. Sex-seeking websites where sex is the topic of conversation are better for notification because the topic of STDs and sex fit better within that framework. There's a more personal, private feel than there is to a social networking site. So when you get that email in that community, it feels like not everybody sees it. You know, if you get that kind of email on Facebook, you already feel very vulnerable in public. So getting this very private information can create different feelings than if you get it on a sex-seeking website. So it's important to remember that websites have feelings, and if you have a choice, to use the right website for notification. When we take a look at Facebook, here are the statistics, and there's a link so you can get these yourself at any time. It's huge, and it's becoming the social hub of the world. I could do a presentation just on the impact of Facebook on our society, and it could be a full-day thing. But the point for us is that Facebook is also used for hookup, and not just by gay men. Facebook is used for hookup by heterosexuals, bisexuals, and homosexuals. There's not a lot of good data on the LGBT community. This is a study from CRI that took a look at the motivation for using a sex-seeking website. And for gay men, there were approximately 30% that were looking for dating and hookup through social networking websites, and Facebook was the primary social networking websites mentioned in the study. There are challenges to conducting partner services on Facebook, the biggest challenge being to contact another person. You have to have a personal profile, and the only way you can have a personal profile is by putting your name out there. So this is a challenge for many departments of health. It's a challenge I think we need to work our way through. Even though Facebook is not best for notification, it is very good for surveillance. You can learn a lot about a person on Facebook depending on their security settings and their privacy settings. This is just a quick glance of the top dating sites. You'll notice that of all the free dating sites that are available on the internet, and this is the latest data that was just from yesterday, Adam for Adam, which is a site for gay men and men who have sex with men, is number 2. And when you think about the percentage of the population that men who have sex with men represent, that's a really significant statement that they're the second largest free dating site in on the internet. So when you take a look at dating and hookup sites, these are some of the features. I think the most important piece is to take a look at things like email and methods of communication so that you know you're secure. when you're communicating with a person online to conduct notification. Manhunt was the #1 site for many years, and they've lost a good deal of their traffic, and now the population has shifted. I think there's lots of reasons for this. Their product changed. They charge for membership, where Atom for Atom is 100% free, which, with the economic conditions as they are, I think that's a big reason why. But they also did a complete change of their website, and members don't do change very well. But one thing you'll notice on both Manhunt and Atom for Atom is that under 80% of the members account for most of the visits. Manhunt tends to be an older site. I've always described Manhunt as a 35-year-old white male, and I've always described Atom for Atom as a 20-year-old mixed race man, and it reflects in their proven demographics. So their traffic is high, and it's being reported as the primary venue of introduction for a lot of infectious diseases. Black Gay Chat is on the rise. I'm featuring these sites because these are sites where we are authorized to go in for partner services and outreach. So there are agreements available for these sites and guides available as well. And then Bareback Artie is a site that was just added to the list of sites that are working with public health. They're not as popular, but they may be an important population. I believe they are an important population to reach. The percentage of HIV-positive individuals on the site is much greater than on the others, and the use of crystal meth and bareback sex obviously is much greater, since it's a site that is focused on unprotected anal intercourse. And it brings challenges to us in public health, because we know that a condom-only conversation is not going to be something that works with this population. So it's important to know that when you go and interact with members on this website, you're not necessarily going to be able to have a condom-only discussion, and if you do, you probably won't succeed in reaching the goals that you may establish. Bareback Artie and other sites tend to have a little further extreme than some of the others. There's been a lot of discussion over the years about things like Bugchasers and gift givers. A bug chaser is an individual who's HIV negative that's seeking to become HIV positive. A gift giver is an individual who's HIV positive who's looking to infect others. In the virtual world, they do exist. I don't know if it always translates into the real world. There's not a lot of them, but there are some out there, and these are some examples. One thing that seems to be evolving with this subpopulation, it's becoming almost a type of fetish to exchange infections, strains of the virus, if you will. So it's something worth noting and being aware of. I don't know how partner notification would work with individuals like this. Hopefully there'll be an event where there'll be some communication possible, but what it takes is an extremely qualified DIS that can create a very non-judgmental and open environment to discuss these issues. So when you look at a profile, it's important to remember that what you see is not always what you get. Here's some example. You see someone here who's just looking to bareback sex, and they don't care what their status is. So they're probably not going to get tested. They don't know what their status is. And at first glance, this looks like a really bad thing. But honestly, this is a form of prevention. Because when an individual looks at this profile, they know what is up with this person. They know what type of behavior they're engaged in, and they know what their HIV status is. So I've always encouraged websites to allow things like this to exist, because it's important information to have. I think one of the most dangerous things we could do is say that we need to make this go away. Well, first of all, you're not going to make the behavior go away. People are going to do what they're going to do. What would happen is you'd make it appear to be something other than it is, right? So these people would appear safe, and none of this would exist. You know, I'm HIV negative, I'm a nice guy, I like ice cream, and I like animated movies. But then when you meet face-to-face, you find something completely different than that, and you're faced with a dilemma. Do you move forward and have sex with this person after you've gotten yourself all worked up for however long it takes to get to the house and interact with the person, and you know, how much have you really talked about before you've shown up? So what a profile knows and doesn't know is very important, and it's important to take the information that you see with the judgment that it may not necessarily be true. You see the bubble butt bottom that's looking. He says that he likes to have unprotected anal intercourse, but he also says his status is negative. And then you see the hairy-chested feeder that says he was tested in August, which may or may not be a form of prevention. There's been a lot of discussion about putting tested dates on profiles for HIV tests and STD tests. And I don't know that everyone has the understanding of what it means to get tested. There, you know, as we all know, there are different tests that are available, and you may be infected, and you're most infectious and still have a negative result, and you may post that on a profile and be actually creating acute infections. So I don't know that that's always the best information that we get. I've taken this profile and I've just posted it here. It's an extreme. You know, this is an example of most. It's not an example of most members. But I think it's important to take a look at something like this and wonder what you would do if this was your patient and how you would approach them. Each case is very unique, and what this discusses is we can't necessarily move forward and continue with this cut and paste approach, meaning I create a script. And in that script, it says, you have come in contact with someone that, and cut that and paste it into an email and send it to someone in a website and in all websites. Because honestly, someone like this is just going to delete it. I would assume someone like this would just delete it. It's important to be able to do online what we do in person, which is take into account the person you're talking to and where you're talking to them. I realize that that creates great challenges, but it's very important, and it talks about outcomes. It's a conversation about outcomes. If you say the same thing to everyone all the time, everywhere, you're not going to reach the people that you really need to reach, because what's being said is very general. It's not personal. It's cut and paste. And it's not necessarily a cut and paste world. So I didn't want to leave us today without at least mentioning apps. Apps are a new culture. Basically how an app works, you see the list of men online here. It's all geolocation-based, meaning the application knows where you are physically. If I'm the gentleman in the top left with the baseball cap and sunglasses, the person next to me is the one with the black hair and black T-shirt, and he may be as close as 400 feet away. I like his profile. I bring it up. I start chatting with him. I like him. I can send him a map of where I'm at and a picture of what I look like in this moment, and we can go ahead and meet. And that's basically how a geolocation-based app works. They've been created for most of the websites that exist, and here's some examples. For example, on Manhunt and Adam for Adam, if you have a Partner Services profile on the website, you also have a Partner Services profile through the app. What this means is that you can do notification through an iPad or through an iPod or through an iPod with a Wi-Fi or through an iPhone. But it also means that if you have access and you're conducting an interview, you can access your profile and work with your original patient, OP, or the person who is tested positive for an infection. You can work with that person and you can find out his contacts. Or if you're working with someone and they have a smartphone, you can ask them to log on with you together and get the information. So the goal of the cultural competency in general is to improve the outcomes, to create that non-judgmental environment, to make sure that there's an understanding by DIS that behavior, identity, and orientation are not always in alignment, and to really do what it is we do, and let people know what we're trying to do, that we're all on the same side, that we're trying to protect individuals from infections. I think it's important to just assume that everyone's on the Internet and they're using the Internet to meet partners. You've got to know where they are. So having the discussion with everyone that walks through the door, if you're a DIS, do you meet partners on Manhunt? Do you meet partners on Bareback Artie? Do you meet partners on? It establishes a rapport immediately. It lets them know that you know what's going on, that you're not talking about something that means nothing to them, and you come across as being completely out of touch and immediately shut down and refuse to give you any information, because why would I tell you? You don't even know what's happening in the world. I think it's important for DIS to have completely unrestricted Internet access. I don't completely understand why they don't. I hear the discussion quite often. And I think that there's safeguards that can be put in place both physically, things such as a separate server and good firewalls, but also in policy that say you can't download applications, you can't interact with games, and there is software that can monitor every keystroke of a person, so you know exactly what they're doing. So I don't necessarily completely understand all of the barriers in reality. I understand them in theory, but I don't necessarily understand them in reality, because with the technology that's available, we can protect both the Department of Health and DIS. So different presentation again. It's important that we understand the venues, that we understand the networks, the terms, and that we have the hardware we need. I mean, imagine that you have, for example, Prism now as your data system. And you're able to actually update your field record from the field. And while you're there, you can log on to all the websites you need to maximize the number of contacts. And while you're there, you can actually get a map and see what the patient's house looks like before you get there, and have something to guide you to get there. And if you have a problem along the way, you can actually click 911 and get help. So I think that you can send and receive email when you get there. What's the name of that testing center? Are they open today? You can look it up while you're with the patient. So I think the hardware and software that are needed are available, and I don't necessarily understand that barrier as well. Maybe you guys can help educate me and we can work together. So general resources, again, this presentation is going to be available, and you'll be able to click on these links and they'll take you where you need to go. And then I didn't want to close without providing you with the contact information. Dana is actually coordinating the efforts of both Justin and myself. So if you'd like to reach out to Justin or me, feel free, but make sure that Dana is included in the conversation. And with that, I'll turn it back over to you, Sandra, and thank you.
Great. Thank you, Stefan. That was phenomenal, very informative. I think you gave disease intervention specialists and their supervisors lots of tools in terms of what they're facing when they go online and how they can better interface with the MSM community on sex-seeking sites. So thank you for that. So I neglected to mention at the beginning of the presentation that everyone can utilize the chat box to send us questions. So at this point in time, we have about 20 minutes if everyone is interested, engaging in a question and answer session with Stefan. Unfortunately, because we have so many people online, that's not the unfortunate part. The unfortunate part is that I will not be able to unmute people because we have quite a bit of participants on the line. But please go ahead and use the chat function to ask Stefan your questions. And so one of the questions that we had from the very beginning, Stefan, it came up around when you were on slide number 32, was what is an OP?
Sure. So an OP is an original patient, so that's the person that tests positive for an infection. So you receive the name from the clinic or from your supervisor, and that's the person that you will interview to obtain their sexual and social contacts.
Great. Thanks, Stefan. So we have a general comment. Someone mentioned that Bareback Real-Time is their #1 site in Portland, Oregon. Immediately after that, someone asked, how did you get the slides? NCSD will be emailing a copy of the slide set in addition to an archived link of this recording. So get both the audio and the visual. As you just saw it, we will forward that to you guys within 1 week's time. Anyone who registered, so they don't necessarily have to be participating live. And we have a ton of questions, Stefan. Okay, next question. How can we contact partners online without knowing their name?
So without knowing I'm assuming you're asking without knowing their first names, because what you have is a virtual identifier, like a screen name to find them. So you wouldn't put an introduction. You could just say, I am contacting you on behalf of. And then when you do interact with them, if they do call, you can do some of the same old methods, which is, and how do you spell your name? So you can actually ask them questions to encourage them to give you their name. And you don't necessarily have to send them any greeting. As a matter of fact, if all you have is a screen name or email address, I wouldn't say dear hot guy for you, because it can be easily assumed that you don't have their name. Okay? You can also use search tools on the internet to take virtual identifiers and try to turn that into traditionally locating information. So there's all kinds of search sites like Spoku and PIPL and Contact Dana or myself for those search sites, where you can put in a screen name and maybe come out with some real world information.
Great. Thanks, Stefan. I'm going to scroll back up. What experience do you have in rural areas such as an Indian reservation?
So I think as long as the infrastructure is there, there's a very large initiative from the federal government, and it's I'm trying to remember the actual name. It's part of the original stimulus package. It's about $5 billion to increase the connectivity and broadband access for rural communities. It's focused on educational centers such as schools and libraries, but what this does is it provides high-speed access to more rural locations. So I say that because the infrastructure is being put in place if it's not now. For rural communities in general, there are fewer venues for interactions, so you can't go to the nearest gay bar because there isn't one. And it's dangerous to go to one of the local physical hookup places that may exist, like a park or something, where the internet makes it safe. So I think even though number-wise, the amount of men who have sex with men on the internet in rural areas is lower, I think the percentage is higher. For example, in New York City, there's a lot of activity just because there's so many people, but less people percentage-wise focus only on the internet because there's so many physical venues that actually are available. So I think it's more important in rural areas.
Great. Thanks, Stefan. Someone else had a question regarding, you said you have agreements with websites. How are your relationships with apps?
Right. So I also saw a question about Grindr, so let me knock those out together. So
yeah.
Grindr is not a good location for partner services. Well, actually, let me back up. It's fine for partner services, but it's not good for partner notification. The first barrier is that they don't allow health organizations to join. but that's not the most important one. The most important one has to do with identity verification. Profiles on Grindr are very different than profiles that you'll find on a normal website. Screen names are not attached to an individual. So if you're conducting an interview with someone who tested positive and that person says, I met Tom, there could be 100 Toms. So there's a new layer of challenges when you go to send a message to Tom. You don't know that you have the right person. So I recommend staying away from apps that are just apps for partner notification. Apps like the Manhunt app or apps like Radar from Adam for Adam are literally connected to the website and use the same database. Screen names are permanent, so they can be used. So the overarching conversation here is that not all of these technologies are created the same, and you have to take a look not at what the platform is, but what the platform does, because they're all different and they all do different things, and they all have different features that can affect your privacy and the privacy of your contacts that you're trying to reach.
Our next question, how do we integrate this in a culture that is rapidly changing the way we interact with the world around them, including each other?
So, I think that's really the point. The point is that we get ourselves up to date. And I think it starts with efforts like this. As Sandra mentioned, this is the third in a series of webinars. There was IPS 101, there was IPS 201, and now there's the cultural competency piece. So these are all intended to help get us up to speed so that we can start to meet people where they are really. Not only where they are through the tools that they're using, but where they are in regards to their behavior and where they are in regards to the attitudes. So I'm not sure if that completely answered your question, but I hope so.
Great. And just to piggyback off of that, we have another question off of that, meaning your discussion of the different phases of technical assistance that NCSD has been sponsoring. We have another question. Is there a plan for CDC to offer formal training for IPS?
One thing that I know is underway is new guidelines from the CDC that are IPS specific. So those are in process. The work that we've been doing over this past year at NCSD has been in collaboration with DSTDP and the National Network of Public Health Institutes. So these presentations are available from us, the presentations that are completed. So that training has taken place and can take a place again. I would encourage you to contact Dana and or myself. I just completed a training in Connecticut, and Rhode Island was there. I'm working now with others in northern New England to try and get a training done there. So please contact us and express your need to myself and NCSD, and maybe we can coordinate with a few other states and we can implement some training. So training is some of the TA that will most likely be available over the next year or so.
Great. Thanks, Stefan. Another question we have is, do you think that most men are honest about admitting their serostatus on these sites? Do you know what percentage of men on these sites are identifying as HIV positive?
Yeah, so there's not been a lot of that that has been looked at online, but there is one study that I referenced in the presentation that took a look at HIV status disclosure. And when you take a look at the numbers, most members do not disclose their HIV status in their profile, and those that state they are negative don't necessarily understand what it means to be tested, what a test means, how the window period and other factors. So honestly, no. I don't think that HIV status in profiles is a reliable bit of information unless someone states they're positive. I think that's the only case. I just brought up that slide for your reference that's got the data that I mentioned.
Thanks, Stefan. And since you pulled up that slide, one of our other questions was curious regarding the individual who listed not into blood or vanilla and was wondering what exactly that implied.
Sure. Not into blood is literally not into blood. So there are, albeit a very small number, but a number of people that are into all bodily fluids, including blood. Vanilla is I guess the best example would be basic missionary position type of sex, just very plain, nondescript sex.
Thank you for the clarification. One of our other participants they were wondering if you are familiar with the study that was done by Associate Member Dan Wolfeiler about what websites would and wouldn't allow for HIV/STD prevention. The study is titled, How Can We Improve HIV and STD Prevention? Sorry, anytime someone puts in a chat, it scrolls away for me. Online for MSM. And their follow-up question was, what do you think the implications could be possibly given the results, if you're familiar?
So I am familiar with the study. Part of my work is to work directly with Adam for Adam to be their health representative. So I write the health portion of their blog. I approve profiles for outreach and internet-based partner services for both Adam for Adam and Bareback Artie. And I also provide consulting for them in regards to health. As part of that, the owner of the website asked that I actually respond to the survey on behalf of Adam for Adam. So I'm very familiar with the survey. So I don't know. I think that it's interesting data, and I look forward to seeing what the next steps are. I think it's important to know the perspective of both websites, members, and public health, and to look at where those perspectives come together. So I look forward to see what's next.
Thanks, Stefan. Let's see. What is the best way to contact the sites to promote testing?
So, hi. I think that there are a lot of resources on the internet for testing. I think that probably one of the best things that can be done is you can use the widgets that are provided from sites like the CDC and their widget for Know It, which is their testing locator that goes by zip code and also by text message. I also think that the AIDS.gov widget that provides all types of different clinics and service providers that you can incorporate into your website is a good thing. If you go to the website internetinterventions.org, you can find the forms that are necessary to create outreach profiles and internet-based partner services profiles on the sites that are listed here. Or you can contact me and we can discuss it further. So, yeah.
Great. Let's see. I'm trying to skim these real quick. Another question is, how many state local health departments can access sex sites, and do we have a sense of how well they contact OPs and their contacts? And what is the quality of data gathered?
there has not been a lot of data that has been gathered on and published. So there's a lot of data that's been gathered. There's not a lot of data that's been gathered and published. There is a published journal article that is based on the experience in Washington, D.C. that had results that were excellent. They were able to contact an additional 381 partners in regards to syphilis over about a 16-month period that would not have been reachable had there been no program. So that in and of itself is justification. But of that population, and this is off the top of my head, I don't have the paper in front of me, but I believe that there was 8% of that were either prophylactically treated or tested positive and treated. So the outcomes when an IPS program is in place and it's supported by management, its staff is well trained, access is granted, the outcomes are as good as traditional partner services. Because really what we're talking about is just using a new tool to do the same thing. We're just really scrambling to get caught up. It's not anything that's ever going to go away. It's not anything that's going to get any simpler. We've just got to get caught up because it's actually going to probably get more complex as technology gets more complex.
Stefan, just a couple more questions regarding outreach on particular sites. One person, again, wanted your opinion on Facebook as an IPS venue. And another person inquired about making profiles in sites for which we do not have formal permission.
Yeah. So Facebook would be used as a last resort if you've exhausted all of your search options. And there's hundreds of search options on the Internet. If you've gotten as far as Facebook, you probably have a first name and last name. And if you have a first name and last name, you can probably get their address, phone number, parent's name, credit history, driving record, and genealogical records. So if you've gotten as far as Facebook, you should have multiple options for notification. My recommendation is that Facebook be used for surveillance and for notification as a last resort. Contacting sites where you don't have a relationship, it's a similar conversation. If you've exhausted all possible efforts through search on the Internet and you need to contact someone through a website and that website is the only place where you can reach them, I would suggest that you contact me to make sure that no one else has contacted them, and together with your supervisor, I'd be happy to help make a decision as to whether or not you should contact the site or just create a profile. It's ideal to have an established relationship because when that relationship is established, the privacy importance is explained. So the websites that I presented here understand what Partner Services is, they know what a notification email is, and they maintain the privacy of that activity. If you just join a website and you conduct notification, that understanding may not be there. So the ideal situation is that there's a relationship. The reality is that a lot of websites just may not want to deal with you. So it may be most effective to just create the profile and see what happens. So there's no one answer. It should be done on a case-by-case basis, done with all the information that's available, and please consider me one of the resources that you can tap for that, and then a decision made with your supervisor based on all the information you gather.
Great. Thanks, Stefan. And for our final question, let me make sure no one else added anything. Well, we have lots of questions regarding future trainings, if you can train DIS to make contact with these sites. Again, do you want to reiterate contacting you and Dana?
Yeah, please. And that's so. Just to give you an example, I've conducted NCSD recently, and through NASTED, and through funding with CDC and NPHI. There's been trainings that have been conducted in California, in New York State, in New York City, and in New Mexico, in Connecticut, in Virginia. So the trainings are available. The curriculum exists. It's always evolving. The training that was just given 2 or 3 weeks ago in Connecticut was a full day of training, and it went from A to Z. Other trainings have been a couple of hours as an introduction to start the conversation. The training that took place in Maryland to launch their program, which was the result of over 2 years' worth of work, was a required training for all DIS throughout the state. It was about 67 DIS that was offered over 3 different days so that they could pick the day and come. And then there was a separate training for the DIS that were selected to do the notifications. So the bottom line is, yes, there's a variety of trainings that are available to meet the needs of your jurisdiction, and to please contact Dana and or myself, and we'll work something out. Hopefully we can collaborate with several states that have similar makeups.
And our final philosophical question to you, Stefan, submitted from one of the participants. They want to know, is it surprising that we are finally beginning to look at HIV relative to the contextual realities of male sexuality, as opposed to looking at things from a predominantly female-focused and heterosexual view of sex?
Yes and no. You know, I think in some forms, sex is just sex, and the difference is the gender. I think the motivations are the same. Since this is a philosophical discussion and not based on data, I know that when I've done introspection, and when I've done introspection with other people, and I get to the core motivators that are beyond the surface level, beyond the mid-level, and get to those core motivators, there tends to be 2 motivators that guide most of my actions. And one is the desire for love, and one is the fear that I won't get love. So when you talk about sex, there's probably an underlying core there. When you get beyond the physical feelings and the addictive, the physical addiction of having that rush. And I don't know that there's huge differences in the core reasons why we have sex. I do believe that there are differences in the way we have sex and the surface level behavior. And I think that, you know, this is what you're pointing to. It's based on the differences that have been created because gay men and men who have sex with men have been, in essence, separated by some of the foundations of social norms, which are, you know, the spirituality of the community and the foundation of matrimony, and some of those fundamentals of structural level factors. So yeah, it's a great conversation, and although we're very different on the outside, I think on the inside we're very, very much the same.
Great. Thanks, Stefan, for your time and for all the information you provided. And thank you to our participants. I know we've gone a couple of minutes over. I just want to reiterate that we will be sending an archive link of this webinar. So again, you get the audio and the visual together, all 90-plus minutes of it, as well as just a set of the slides for you to look through. As soon as you log out, you'll be directed to an evaluation. It is really important that you provide us with your feedback. There are questions regarding what TA you're looking for around the subject matter and IPS, so please let us know. As Stefan mentioned, please reach out to either he or Dana if you're interested in receiving trainings. For those of you, and I know there were a few in the chat, if you have specific questions regarding the stigma survey that Justin mentioned, please contact Justin. He'll be happy to provide you with more information. And again, thank you so much.
Thank you. Please stand by.